Welcome back. November marks the start of Lung Cancer Awareness Month. Here to discuss the effects of the life-altering disease is Dr. Linda Haramati of the Montefiore Health System and Albert Einstein College of Medicine. Dr. Haramati, thank you for joining us.
Thank you very much for inviting me. It's a pleasure to be here.
So I wanted to start off by saying lung cancer is the second most common cancer in both men and women. I'm always curious to know how these various types of cancers affect our body. So can you just explain what happens when you're diagnosed with lung cancer?
So lung cancer, it develops inside the lungs itself or within the airways where we take in air from the mouth that going into the lungs. And the abnormal cells start to proliferate and develop into cancer, which is actually, in most cases, a slow process. And the disease, the disease manifests clinically a little bit later on, but we can catch it at a very early stage if we do lung cancer screening.
Now, I'm curious to know, like in my research, I found, I don't know if this is true, that there's multiple types of cancers. Can you just confirm that with me and tell me a little bit more about that? Well, lung cancer, I'm sorry, multiple different types of lung cancer.
There are different subtypes or cell types of lung cancer. All of them are associated with smoking. Some of them are more slowly growing. Some of them are more rapidly progressing. But all of them have a lot of things in common, including the parts of the lung that they affect, and the kind of the approach to treatment varies somewhat depending on the subtype.
Now, I understand that you have a lot of background with screening for this disease and was part of a program that specialized in this. Can you tell us more about that experience?
It was really exciting to be a part of lung cancer screening at Montefiore. In 2011, a very important clinical trial was published where they looked at using CT scans, CAT scans, a kind of X-rays to evaluate for whether or not using that screening with CAT scans saves lives from lung cancer. And it showed that there was a dramatic improvement in the lung cancer survival when screening eligible patients with CAT scans for lung cancer. And after that trial was published, we began a lung cancer screening program at Montefiore focusing on our patients in the Bronx and reaching out to the appropriate population. And we've had a really successful program since that time. We enrolled our first patient in 2012, so it's been 9 years, and the program is growing and growing, and we're trying to reach out to more and more eligible patients in order to save as many lives as possible from lung cancer.
Now, do you find it challenging to find patients that are at risk, or maybe those patients are a little bit apprehensive towards getting screened?
Well, we rely on the primary care doctors to refer the patients to us. But I think that's a known thing with lung cancer in particular, is that people are very, there is a certain amount of apprehension about screening for lung cancer because of the link with smoking. And there's some stigma that's been shown that people are a little bit more reluctant to come for, say, lung cancer screening than breast cancer screening, which also had a stigma back in the day. But now there's much more awareness of the importance of breast cancer screening. And for lung cancer screening, we're in the earlier stages of trying to overcome that stigma.
Oh, wow, that's interesting. I really didn't know that. So thank you for sharing that with me. Now, according to the American Cancer Society, lung cancer is by far the leading cause of cancer death among both men and women, making up almost 25% of all cancer deaths. It's commonly understood that smoking, like you mentioned, plays a part, but are there any other lifestyle factors and habits, as well as inherited genes, that can heighten your risk?
So it's true that lung cancer, the most common risk factor for lung cancer is cigarette smoking by far. And the amount that you smoke and the length of time that you smoke and how recently you smoke are all factors. Other less common factors are secondhand smoke, say you grew up with a heavy smoker, or you work in an environment where there's a lot of smoking, which is much less of a factor nowadays because indoor smoking in the work environment has basically been eliminated. But if you have a history of that, another risk factor for lung cancer is occupational exposure. For example, asbestos exposure is a risk factor for lung cancer. And then another interesting little niche area is exposure to radon, which is like in the homes. So like if you move into a new home and they say test your house for radon, radon is a gas that's emitted from the rocks beneath you. So if you live in an area where there is radon within the rocks, then it's recommended to test your home for radon. And because radon is a gas, it's a very easy solution, which is just to increase ventilation inside the area. It's usually in your basement, and that markedly decreases the amount of home radon exposure. So that's like a little bit of an interesting factor. But all of those are less common risk factors than smoking. Family history is also important, and is a risk factor.
Now, many people try to avoid, with the smoking, so they'll switch to vaping or hookah and other recreational activities. Will these have the same or similar outcomes?
So that's a very controversial and hip topic. So I'm glad you raised it, although I am not an expert in vaping and hookah. The FDA just in October, a couple of weeks ago, put out a call for using certain vaping products to help adult active cigarette smokers reduce their cigarette smoking activity, because they feel that vaping, for the most part, is a harm reduction strategy for people who are trying to quit smoking, and it's another opportunity for nicotine replacement. But it is very controversial in the literature. And there are cultural issues, because obviously we don't want young people who are not addicted to nicotine to become addicted. And there's been some targeting of the youthful population for vaping, and hookah. As far as I know, there are no medical uses for hookah. But like I said, I'm not a vaping and hookah expert.
All right, well, thank you so much. I'm happy that we did touch on that, because it was something I've heard many times before. I'm also curious to know, how does this affect those who just quit smoking entirely? So let's say maybe you smoked for a long period of time and then you suddenly quit. How does your risk change then?
So quitting smoking is probably the most important thing you can do to reduce your risk for lung cancer. And your risk of cancer decreases basically every year that you've quit smoking. So it's a really, really important thing. And the farther away time-wise that you quit smoking, the less your risk of lung cancer. But nowadays in the United States, there still are a lot of people who are former smokers who develop lung cancer, even though it's at a reduced risk, which is why for lung cancer screening, we will screen using the current eligibility criteria. We will screen both current smokers as well as former smokers who quit within the last 15 years. And they had to have a heavy smoking history of at least 20 pack years, which is basically smoking a pack a day for 20 years or a half a pack a day for 40 years, so that it's the number of packs a day multiplied by the number of years, and to give you a total of at least 20 pack years of smoking. Screening is also eligible using the latest criteria for people who are in the age range of between 50 and 80. So current or former smokers who are actively smoking or quit within the last 15 years and are between ages 50 and 80 would be people who would be eligible potentially for lung cancer screening.
So what are some prevention methods people can take I know we said stop smoking is one of them. Are there any other prevention methods people can take to lower their risk?
Well, even reducing the amount that you smoke lowers the risk. So if you're an active smoker, you should never think that you can't lower your risk. You can smoke less, and quitting takes, for many people, multiple attempts. People need help with that. So it's something you should never give up on, quitting smoking, which is a really big goal. And there are many different strategies out there, to help people quit smoking. So that's really important. And then there's the radon in your basement. You can test your basement for that. And then once you're eligible for lung cancer screening, that's an important factor, because screening detected lung cancers tend to be at a very, very, very early and curable stage. And so that is a chance to save your life. And it's been proven at the highest scientific level with what they call randomized clinical trials, which is the highest level of evidence that we use in medicine.
Now, typically the Bronx faces higher risk when looking at so many health conditions. Did you find that in regards to lung cancer?
So when you compare, for example, Bronx population with Manhattan, the risk of developing lung cancer is higher for both men and women, and it's higher as you get older. So there is an increased risk of lung cancer within the Bronx for whatever variety of multifactorial reasons, as is the case for most cancers.
Now, can you just let people know where they can learn more?
So in terms of learning more about lung cancer?
Learning more about lung cancer and screening.
Oh, so, well, the U.S. Preventive Services Task Force, called the USPSTF, has these new guidelines that were published in 2021. And if you look on their website, USPSTF, you should be able to find those guidelines and read about the opportunity to save your life with lung cancer screening. And it's really something that is like discuss with your doctor if you're a current or former smoker, to talk about the options for quitting smoking and also undergoing screening if you're in the appropriate category.
All right, doctor, thank you so much for joining us.
Thank you so much.
That's all for our show today. Thank you for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.